Discussion of the treatment of ADHD. Let me first introduce Dr. Theresa Cerulli. Dr. Cerulli is board certified in psychiatry and is on staff at Beth Israel Deaconess Medical Center in Boston and Hallmark Health's Lawrence Memorial Hospital. She received the 1997 Harvard Residency Teaching Award and has continued in her role as a member of the Harvard Medical School faculty as a clinical instructor. In addition, she is the co-founder and prior chief medical officer of ADD Health and Wellness Centers and is on the professional advisory board of ADA, the Attention Deficit Disorder Association. Welcome, Theresa.
Thanks, Matt. Good evening.
All right, nice to have you here. It's also a real pleasure, to introduce Dr. Rakesh Jain to the show. Dr. Jain practices psychiatry in Lake Jackson, Texas. He is the recipient of the National Research Service Award for the support of the postdoctoral fellowship. Dr. Jain is currently involved in multiple research projects studying the effects of medications on short-term and long-term treatment of mental disorders in children, adolescents, and adults. He was recently named as the Public Citizen of the Year by the National Association of Social Workers Gulf Coast chapter in recognition of his community and peer educational initiatives and championing mental health issues. Welcome.
Thank you so much. Appreciate it.
Now, I imagine that a confirmed diagnosis of ADHD can be daunting for many patients. Theresa, can you tell us about available community resources or support that would be of value to your patients or their caregivers?
Yeah, absolutely, Matt. And there are just several wonderful resources available, particularly online for children with ADHD, also for their parents, their caregivers, teachers, professionals. One of the websites I refer patients to frequently is the CHADD website. That's chadd.org. It stands for the Children and Adults with Attention Deficit Hyperactivity Disorder. A lot of resources on there, also on the CHADD site for educational information with ADHD. IEP planning, 504 plans, information on the American Disabilities Act, so guidance for even needing academic accommodations such as untimed tests, the SATs, et cetera. So that's one of those sites I refer to. This would be a good time for audience members to take out their pens and pencils and note down some of these resources. There's also the National Resource Center on ADHD. That's also a CHADD program that has links to educational information as well.
That's great. Thank you very much. Now, what about resources for adults with ADHD?
Glad you said that, Matt. And again, looking at me, I may look old, but I graduated about 25 years ago from medical school, and I got to tell you this, I didn't get one single lecture on adult ADHD.
That's still true.
It is true, isn't it? And I heard you talk with Dr. Otis about the prevalence of ADHD in adults, and I think the number was 9.8 million people. That's a terrible tragedy. So I'm glad you asked me about resources for adults with ADHD, and we have quite a few. And on the screen, just like yourself, I brought a few resources from my colleagues. One of them is the ADD.org website, which really is the website for ADA, which I understand you are on the board. Nice job. Well done, Theresa.
Thank you, Rakesh.
Absolutely. And the other website that I really like to recommend my colleagues visit would be the ADDresources.org, which has even more information. You know, knowledge is power.
Yes.
It's a Teflon coating. And with ADD in adults, ADHD in adults, it's a real lack of information that's an issue. And let's not forget that the National Institute of Mental Health has weighed in and has what I think extraordinarily good information that we could share easily with our patients and their families.
Great. Well, Rakesh, what about resources that are available for healthcare providers who are treating ADHD? You know, as a primary care physician, you know, just as you said, we don't get a lot of information on this in school. So what kind of resources are available?
Sure, quite a few. And the good thing is, as you and Dr. Otis were talking about, the APA has the DSM-4, and DSM-4, with some of its difficulties, still applies to both children and adults. And they have a wonderful website called www.psych.org, which is the APA's website. Though being a child psychiatrist, I will say that with ADHD, child psychiatrists have taken the lead, and ACAP, the American Academy of Child and Adolescent Psychiatry, have both a wonderful website that if my colleagues haven't visited yet out in the 60 centers that are listening to us, may I be the first to encourage them to go to it and check it out. That, by the way, also has practice parameters that are incredibly useful. And then, of course, we talked and heard about the use of rating scales. And there's a website that we have here called neurotransmitter.net that is actually incredibly rich in resources as far as free and occasionally paid scales and screeners that we could use.
Great. So basically, my peers in primary care can get on these websites and download the rating scales, and actually patients can get on that as well if they so desire, and possibly take that and bring it into the doctor.
Absolutely, Matt. Let's not ignore the fact that primary care and pediatrics and psychiatry and child psychiatry, all of us, if we use them, I think we enhance patient care.
That's great. Thank you. Well, let's turn to the expert guidelines for ADHD, specifically the American Academy of Child and Adolescent Psychiatry's ADHD practice parameters. Would you all speak about the importance of the parameters in clinical practice? And let's start with you, Theresa.
Sure, Matt, the ACAP practice parameter is extremely helpful. It really sets the standard of practice guidelines for all of us. The practice guidelines are based on empirical evidence and clinical consensus. Some of the key recommendations from those guidelines are: 1, screening. So screening for ADHD really should be part of any mental health assessment. We talked about, Dr. Otis talked about the prevalence of this condition. Given how frequently it is occurring in our patients, we really should be screening on a regular basis for folks coming through our doors. Evaluation, so besides screening, we want to look at the evaluation and the practice parameters. What's recommended is the ADHD evaluation should consist of clinical interviews. That is the gold standard still. There is no blood test. Clinical interviews with the parent, with the patient. You want to obtain information when possible on the patient's school functioning, get feedback from the teachers. You also want to evaluate for comorbid psychiatric disorders. Extremely important point, because there's many things that can cause inattention, so you have to exclude all of the other things that might present like ADHD when it's not. You also want to review the patient's medical history, social history, and family history. The genetics with this condition are strong, so family history is going to tell you a lot of information. The parent should complete one of the standardized rating scales that we talked about, some websites where you could download those. And there are many different forms of rating scales: the Vanderbilt, the Connors, the Brown scale. It's not that one is better than another. I just recommend that you be familiar and comfortable with at least one of the scales that you can use both in the evaluation and in follow-up care to look at improvements. And then finally, really emphasizing that family history and family functioning need to be assessed. What's going on in the household can certainly be a factor in causing people to have problems with attention and concentration.
Great. Rakesh, what are your
Great words of wisdom. How can one build on that? Well said, Theresa. What I might perhaps add is it is very important that we look for comorbidities. Now, we have a wonderful saying in Texas, which is, a dog can have ticks and fleas. Pretty much what it's saying is, you can't just stop with ADHD as a diagnosis. You really have to run the comb of differential diagnosis to make sure you're not missing something of importance, be it psychiatric or medical. So comorbidity, we ought to search for it. You know, there are lots of sins we sometimes commit. There's, of course, the sin of not knowing, but the sin of missing something is 10 times worse. So I want to make a big deal about that. Also, if you have teenagers, it might be a good idea to interview them separately from their parents. I'm always surprised that I make this erroneous assumption that parents over-report, children under-report. I have to admit this to you. Occasionally, it's the opposite. So it's really a good idea. And then finally, individualized treatment plan setting is the idealized way to do it. Don't just fit them into a cookie cutter. Look at the patient, look at the strengths, look at the weaknesses, create a treatment plan that could include both behavioral modification and or could include pharmacological treatment.
Great, great information. Melvin, is there anything you'd like to add?
Sure. Also thinking about this, that the psychological and neuropsychological tests are not mandatory in making the diagnosis of ADHD. It's your real detailed clinical history. The clinician must evaluate the patient for ADHD in the presence in thinking about the comorbid psychiatric disorders, as Rakesh has said. And a well thought out and very comprehensive treatment plan should be developed for the patient that has ADHD. And think about the patient treatment plan. Think about ADHD. It is a chronic disorder, and it has to consist of both the pharmacologic as well as the behavioral management.
Great. Well, thank you. You guys, this is fabulous information. I'd like to thank the faculty for their informed contributions to our discussion.